Our profession started out at home, taking care of our family members. It started out then going to the battlefield and caring. That's how our profession started. And then later on it became more technical, and it became more almost sterile, almost stainless steel is what comes to mind. And now nursing has kind of gone as far as it can go that way, even though it continues to be very technological and very professional. But the theories and the style of nursing and the heart of a caregiver is still there.
How did you get your title, the singing nurse, by the way?
How did I get the title of your singing nurse?
The singing nurse.
I've been singing my entire life. People can't seem to get me to shut up, so they eventually just embrace it as part of my personality. I paid for college by mowing lawns. And even when I was mowing the lawns and things like that, I was always doing segments of West Side Story or whatever was on my mind at the moment. Somewhere between West Side Story and Garth Brooks. One of the first places I worked in had a lot of hospice patients. And so, again, it being part of my normal personality, I was always singing on the floor. I didn't usually notice it. I'd be preparing my medications, looking through my list, my doctor's orders. I'd always be singing. A lot of my patients or family members of patients would come out and they would listen to me. They would ask me to start coming into the rooms and singing. Especially working with hospice patients, it started becoming a very useful tool. Talk about breaking out of the traditional medical drone mold that we can get in if we're lazy and we just become task-oriented. Remember, you got to keep pushing to be personable. That gives a useful tool, it provides a useful tool to not only be vulnerable to my patient, but to encourage them to be vulnerable back. You can learn so much about somebody if they trust you.
What we are becoming and how we're growing, and all of the different ways that we can grow, and all of the different ideas that we can have. The caregivers and the people with the hearts to care for people don't do it for the money, don't do it for other kinds of motives other than for that smile, other than for knowing that they made a difference in someone's life that day. And maybe for the rest of their life, you never know.
Okay, here we go. Smile. Smile, though your heart is aching. Smile, even though it's breaking. When there are clouds in the sky, you'll get by. If you smile through your fears and sorrow, smile and maybe tomorrow you'll see the sun come shining through. For you, light up your face with gladness, hide every trace of sadness. Although a tear may be ever so near, that's the time you must keep on trying. Smile, what's the use of crying? You'll find that life is still